As a healthcare aide, you already work hard to maintain a safe home for your residents. Changing the way we do some parts of our daily work will make it even safer and will cut the risk of infection. And you'll know that you're doing the right thing to increase safety by preventing the spread of infections to our residents. Hands are the most common way that healthcare-associated infections are transmitted in a home. Cleaning your hands is the most effective way to prevent the spread of infections in our home. A simple alcohol hand rub of 15 seconds will make all the difference and is the preferred method. If your hands are visibly dirty, you will need to wash them with soap and water. The power to make a difference is in your hands. Your 4 moments for hand hygiene will break the chain of infection and safeguard your home, your residents, and you. You need to follow the 4 moments whenever you work in the resident's room. Moment number 1. Always clean before initial contact with the resident or the resident's room. Cleaning hands before initial contact is required to protect the resident from harmful organisms carried on hands from the home environment outside the resident's room. Clean your hands when entering the resident's room before you touch the resident or their area. Moment number 2. Clean your hands immediately before any aseptic procedure to protect the resident against harmful organisms. Aseptic procedures in long-term care that you may do are procedures such as mouth care. Moment number 3. Clean your hands immediately after any exposure risk to body fluids to protect yourself. We can be exposed to body fluids when we handle waste or make contact with contaminated and visibly soiled materials. For example, when doing any continence care or toileting, hands must be cleaned. We have to clean our hands anytime we have any possible contact with saliva, urine, feces, vomit, or blood. This can happen to us whenever or wherever we're doing activities with exposure to broken or open areas, when wound dressing, giving injections, drawing blood, doing mouth care. Clean hands after putting on protective gloves, which should be used if exposure to body fluids is anticipated. Gloves must be used correctly. They must be changed after each task so organisms are not spread by the gloves. Hands and gloves can become wet. Wet hands are a frequent cause of skin breakdown. Wear gloves for as short a time as possible and always clean hands after removing gloves. Hand hygiene must be performed immediately after body fluid exposure risk before touching either the resident again or any surface and object within the resident's room to protect yourself and the healthcare environment from harmful patient organisms. Moment number 4. Leaving the resident environment after touching the resident or any objects or furniture in that environment is the final moment in the 4-moment cycle. Before you contact any other part of the home, you need to clean your hands again to protect yourself and the healthcare environment. When you are assisting with any activity in areas outside of the resident's room, you need to clean your hands before beginning and after ending the activity. Whenever you have to perform direct care with a resident, no matter where you are, the 4 moments must be followed. Direct care is hands-on care such as bathing, washing or turning a resident, changing clothes or providing continence care, changing dressings, and caring for open wounds or lesions, as well as toileting. For example, you're often doing continence care and toileting, which is direct care, so hands must be cleaned when finished. A common activity in the home is helping people eat or drink. Any type of feeding, like giving liquids, snacks, meals, requires us to clean hands and the hands of the resident. Clean hands before beginning the feeding and after the feeding is finished. If during the feeding you're exposed to any saliva or mucus or other body fluids, then you need to clean your hands again to protect yourself and any residents you might touch. If you're going to touch the inside of the resident's mouth while feeding, you need to wear gloves. Clean hands before putting on gloves to protect the resident from organisms. After removing the gloves, clean hands again. Your skills and dedication are an essential service to this community and in this home. Thank you for taking the time to clean your hands. Look after your hands and look after your health. Just clean your hands.